The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
Earlier, we introduced a procedure to replace an aortic valve without open heart surgery. This is a transcatheter aortic valve replacement known as a TAVR procedure. It's happening right now in the cath lab at University Hospital's Cleveland Medical Center, and we are along for the ride. Dr. Sabik, Dr. Attizzani, and the team have been busy. I have to ask, how's the procedure coming along, Dr. Sabik?
Oh, it's going very well. We're just about ready to put the valve on the catheter, so it's moving along beautifully.
That's it, right?
That's the valve. That's the actual valve that's going to go into our patient today.
Oh, that's remarkable.
And when you pass it, it sort of fixes itself in place? How does that work?
So what happens is we're using imaging, and we're using fluoroscopy, which is X-ray, to know where we are. And there are certain landmarks that Dr. Attizzani is looking at. And so he positions the catheter and then positions the valve exactly where he wants it to be under direct imaging. So it's real time. And then he blows up the valve, releases the valve, and it's the radial force of the valve that holds it in place. Now, how does the valve work? And it really just works because of the pressure differential. You know, when the heart contracts, it pushes the blood, which opens the leaflets, and the blood comes out of the heart. And then when the heart relaxes, the blood starts to come backwards, which catches those leaflets, and those leaflets then close. So it's just very simple fluid physics, I suppose. Okay, so what we're now doing is starting to load the valve, you know, onto the catheter. And that's the crimping that we talked about. As you all saw a little earlier, Dr. Attizzani had showed you the valve and how large it is. You know, it's got at least 1 inch in diameter. And now we want to take that valve that was blown up and now crimp it so it can go on a very small catheter. You can also see the device. It's, like I said, it's an amazing piece of technology. I suppose when you think about it, when we think about heart surgery, it's a lot of technology, and they've been able to take what we would normally do with a heart-lung machine and general anesthesia and put it on a catheter. So we shouldn't be surprised that this is a complex technology and procedure, but you're going to see it done, and it's going to look so simple.
What is the time sequence in a typical procedure like this? How long does it usually take you?
Literally, it can take an hour, 2 hours. I don't know if you can see it, but the valve is crimped and loaded onto the catheter. And Dr. Attizzani is just about ready to take it, and the procedure will be happening momentarily.
How long does this procedure typically take if you're doing open heart surgery?
About, 3 to 4 hours. It usually takes us maybe about 45 minutes to an hour to open the chest and get the patient on the heart-lung machine. And then about another 40, 45 minutes with the heart stopped while the valve is implanted. Then we let the heart recover. But I'm going to come back here, and here you can see the fluoroscopy, and you can see the valve that's crimped now on the catheter. And Dr. Attizzani is now going to be positioning this in a very short time.
Valve is well crimped.
Thank you.
Okay. All right. Go back to the projection, please.
22 dill.
22 dill going in. Back to the projection. So what we're going to do now, we're going to pre-dilate this valve to enable the new valve to go in. We're going to go with a balloon inside.
So to prepare the valve for the TAVR valve, Dr. Attizzani is going to dilate the valve. So when someone gets aortic stenosis or a blocked valve, it's very calcified. It's almost like rock hard. And so he wants to prepare that so that he knows that his valve can open very well inside the patient's native valve.
Feed me wire, feed me wire, feed wire. I'm going to pull back the balloon, feed wire. Feed.
And you see that wire that looks like it's curled, that is actually inside the patient's heart right now, inside the main pumping chamber, the left ventricle. The other wire you see is actually a pacemaker wire that's in place, the one with the 2 dots on it. They're going to position the balloon, and then the balloon will be inflated inside the patient's native valve so it can open. It's called a balloon valvuloplasty.
Go in and hold the wire, please.